So good to see everyone. Thank you for coming, taking time out of your day. We are here to discuss and to share ideas and hopefully stimulate new ideas and to help each other with this amazing opportunity. We found out just about a little less than a month ago that health centers were going to be receiving a good chunk of funding to help them with their COVID response and beyond under the American Rescue Plan Act. So we are here, as the council always does, and what makes the council so wonderful is that we share information with each other, we brainstorm together, we share things that have worked with each other, things that have not worked with each other, and what we do really well is figure out things together. So I like to say, no matter what you're doing, chances are someone else in the council community has done it or is doing it or is thinking about doing it. So there's no reason for us to do anything alone. So I'd like to introduce myself. I'm Bobby Watts, the CEO of the National Healthcare for the Homeless Council, and thrilled to begin. And we're just going to start by say, you can have the next slide, just to say what some of the things we've done so far. In our committee meetings, we have gotten some ideas. It's stimulated other ideas at the board meeting when this came out the day before. We spent some time at the board, and each of our networks, Clinicians Network, Respite Care Providers Networks, has been talking about this. And we wanted to say we need to have a special group to come together because there was so much interest. So going to start a series of polls and ask you to respond. We want to find out what you've been thinking, what you're looking forward to, what you're hoping to get out of this. And then at the end, we also want to find out how can we support you in that. So there's a brief summary. There are $6.1 billion for health centers, including this is one-time funding. So the beauty is it's a lot of funding. One-time funding can be tricky because you want to find out how can we spend it in ways that will maximize our impact, but understanding that funding will be ending after a 2-year period. And we really want to encourage people to think through how can we make a maximum impact to systems. All right, and we see in the chat some of the fact sheets and some other things, information for HRSA's question and answer. And Brandon, can you put up the first poll? So just want to find out who you are. Tell us who you are, and just fill this in quickly, and we'll keep moving. And as you're doing that, and we see how many of you are coming in. Many of you are, most of you are FQHCs. We want to make sure that we are spending the funds in compliant ways. We're sure that there are some things that everyone is going to do, but we also want to learn from each other on things that you may not have thought of or that you're thinking of. It may be helpful here that other people are thinking of that, and how can you figure out some shortcuts to do that or to avoid. So it looks like we have just over half of the people those in attendance are FQHCs, and the next largest is our medical respite providers and continuum of care or housing providers, and yeah, we're doing well. So Brandon, I'll ask you to close the poll when you think it's ready, and I'm really looking forward to we have some presentations. And we will also have time for some discussion between us. All right, so just over half are FQHCs. So the next poll, please. So we're sure that all of you have begun to think, and you've come here to hear what others are thinking. So just want to ask you to say, what type of funding activities are you currently considering with this funding? And you see some of the categories. Looks like vast majority, well, it's shifting quickly, but over half is for their COVID-19 response. And these are overlapping responses. They're not mutually exclusive. Staffing, technology, IT are big. Also, we see quite a few are looking at vehicles and capital. So we will talk about that. Technology, equipment, great. Thank you. And we're just really grateful that you're here and looking at, it looks like we're pretty much COVID-19 response in one way or another is the top response, as it should be, and that will be accomplished in a number of ways. And we also really want to, we'll talk a little bit more about medical respite. We'll talk a little bit more about some other opportunities with partnership building. To me, one of the most exciting parts of the funding announcement by HRSA, their brief, was that this can be used to develop partnerships in support of your community that you're serving. For us, people experiencing homelessness, we know when we're serving people experiencing homelessness, we have to engage with other systems if we're going to be effective, and we do that every day. And we've just put in our brief, and I am going to turn it over to our Senior Director of Policy, who has really taken the lead on much of our COVID work and helped us coordinate in our regular meetings internally, to Dr. Barbara DiPietro. Thank you so much, everyone. I look forward to the conversation.
Thanks, Bobby. Really appreciate it. And thanks, everybody, for being here. I know how precious everybody's time is, but I think this is a really exciting opportunity and a discussion to be having together as an HCH family. As Bobby had mentioned, there is another opportunity to talk with HRSA in one of Jim McCrae's question and answer session next week. And the information is here on this slide. And Bobby had mentioned our issue brief, which does do an overview of this funding, but we just wanted to hit the highlights in our discussion this morning, just so that we could make sure that everyone's working with the same information. We know everybody is involved in this funding opportunity in a different way. So next slide, please, Brandon. And so as many of you probably know who were working with this funding opportunity, HRSA outlined 5 broad categories that have eligible activities. First and foremost, obviously, is to expand our capacity to respond to COVID. And so each of these entries here has more information at HRSA's website about what these entail. But obviously being able to expand our capacity to participate in vaccine responses, as well as other COVID response and treatment like testing, contact tracing, enabling services, and all of that. Very important as we continue responding to COVID. But next slide. But then we also have got 3 other broad categories that HRSA has outlined for us that I think give us a lot of flexibility. And so you'll see here that the bolded and underlined items are those things that we thought most directly were related to community partnerships or these broader, more systemic community improvements that we might want to consider as we move forward. I think no one is doubting that there are significant current immediate needs that we need to either backfill losses or being able to shore up staffing and other pieces, as evidenced by your responses in the poll question on where a lot of us are focused. But then I think this does give us a broader opportunity to think about what are the other possibilities we could use beyond kind of shoring up and backfilling? How do we want to envision real strategic structural changes? So I think this gives us some opportunities here. And then Brandon, if you go to the next slide, I think we just wanted to pull out 4 of these areas that are fairly general when used on their own.
But you were going to show us your preference.
But this is This is going to be, this information here is drawn directly from HRSA's website. So we can see more of the detail that HRSA has provided for this. But Dr. Darlene Jenkins here will talk in a minute a little bit more about community partnerships and what those might entail. Julia Dobbins will just do a quick overview on some of the potential that we have in using this for recuperative care or medical respite care in maybe some startup funds or what have you. And then we have partners from HUD. Hopefully Richard Cho from the Secretary's Office at HUD has joined us and can talk just a moment about how we might use this in some really creative ways in expanding services and supportive housing, but really looking at that core social determinants of health, which is where so many of have been focused in terms of that intersection of health and housing, particularly over all that we've learned in the last year. Next slide, please. And so this list here are like 8 possibilities that we've put in the issue brief that we see as opportunities, not just to strengthen the clinical services and programs that we offer within our traditional purview and within our walls, but also thinking more about how can we bring a lot of this out into the community and grow the community partnerships that we've been growing over the past year as we've been working with new partners and bringing up new programs. But I think what we want to do really is focus on this collective challenge. And so this is an unprecedented amount of money that is coming to us as health centers, but there's also an unprecedented amount of money that's coming down through all communities to pay for housing and other types of healthcare. So I think this is a real opportunity for us to think about how can we really look at our community and say, that when we leave this pandemic, how is our community response better to homelessness than it was last March? How do we leave this pandemic in a stronger place than we started this pandemic? And how do we really use this opportunity as something where we can be innovative, creative, and maximize the funding opportunities that are coming in multiple ways to our community to do something more strategic, structural, and permanent? So I think that's where we wanted to focus today. And so next slide, please, Brandon. We had posed these same questions about how are you planning on using these funds to our administrators committee, our policy committee, and a number of the other groups that we work with regularly at the council. And these are the kinds of feedback that you had given us about where you were thinking. But I'm going to turn it over here just for a couple minutes to my colleague, Darlene Jenkins, who can talk about community partnerships and what a vision for that might be. So Darlene, I'll turn over to you.
Great. Thank you so much, Barbara. And good afternoon or good morning to those who are on Pacific time. We'd like to just thank you and welcome you for spending this time with us. You know, when we started thinking about community partnerships, of course, for the council, our minds went directly to medical legal partnerships. You know, as you start thinking about, again, systematically, what can you do to impact the community? For the last 5 years, as many of you may know, the council has partnered with the National Center for Medical Legal Partnerships to establish medical legal partnerships and to integrate lawyers into the healthcare setting. So we're saying with this money, we could really start looking at how health centers can offer legal services to allow patients more access to these services that can handle evictions as well as some of the other civil legal needs that many of the patients face. So again, as we start looking at community partnerships, considering establishing a medical legal partnership is something that we think should be a part of that consideration. Also, as you see on this list, some have mentioned that they would like to look at food security, and that is a great opportunity to consider some of the community partnerships that you could bring together. One is thinking about developing a community pharmacy, food pharmacy, where you're actually establishing a medically tailored food pantry where patients, say if they have diabetes or hypertension, they can actually go to a pantry and where the food is marked and they can select fresh fruits and vegetables and other things that are tailor made for their chronic condition. This can be a partnership with a farmer's market. It can be a partnership with your university extension center. Many of the universities in a community have a master gardeners program where you can work with them establishing a community garden, a hot house there on your at your organization. You can also start a mobile food market, partnering with the farmers market, or even consider a corner grocery food initiative. I know one community in Kentucky really worked with their community small corner stores to offer more fruits and vegetables. Even thinking about working with your shelter. How can you work with the shelter maybe to perhaps start a community garden? So again, looking at community partnerships where you can address the social determinants of health. One, again, medical legal partnership, as well as food security and increasing healthy food options in your community. Another thing we thought about when we were planning this forum or this discussion and trying to give suggestions for community partnerships, the issue of telehealth, of course, came to the forefront. And there may be opportunities where you can partner with shelters. I know several health care for the homeless health centers are now partnering with their shelters to provide kiosks where they have done some risk stratification, looking at what patients can benefit from telehealth, looking at investing training to ensure that their staff has the proper training and increasing technical literacy for health for their staff as well as patients. So looking, how do you partner within your community to offer access to telehealth? Seeing how you can also make this a permanent thing within the community. And then finally, as we talk about strengthening community partnerships, one thing we want to also emphasize is how do we partner to strengthen and increase access for health services to the justice-involved population. This can be establishing a relationship to provide health services to individuals who are currently serving sentences in the justice or who are involved in the justice system, or strengthening health services to those who are released. How do you connect them to primary care? So looking at the transitioning out of the justice system where they face barriers to health as well as housing. How can you bring community partners to address those who are coming back or re-entering into your community? These are just some of the suggestions. It may perhaps require some forums that you can host for your community to come together or your patients come together to discuss. The main thing is to really have some open conversations so that when you do make your decisions, they are informed decisions, and hopefully they will make a positive impact on your community and those who you serve as well as others within the community. So that when this all said and done, they can actually say, we have made a difference and we've moved a needle on the issues that are impacting our community. So that's what we were suggesting, and hopefully if you have any questions about any of these initiatives or something that I've said, we're more than happy to help walk through the conversations, to provide resources, and to help really try to inform and give you information so that you can make your decisions moving forward. So with that, I think I'm going to turn it back over to Barbara for our next speaker to try to highlight some of the ideas that you may want to consider.
Thank you, Darlene. At this point, I want to introduce Dr. Richard Cho, who is Senior Advisor in the Secretary Marsha Fudge's office at HUD. And Richard has worked with us at the Healthcare for the Homeless community for many years, particularly on issues of supportive housing and how to be getting more housing into our communities. And so when I told Richard about this community discussion, I had asked him if he could just pitch his vision for how the health and housing funding can come together. So Richard, I'll turn it over to you to talk about what you see as opportunities from your perspective.
Great. Thank you so much, Barbara, and for the National Healthcare for the Homeless Council for putting this together. I guess you've put together such a fantastic list of ideas and potential uses of these funds. And, again, kudos to the council for always kind of pushing all of us to think beyond the kind of immediacy of the moment, where I know many of us at this moment are just thinking about, what are we doing at this moment as we're massively rolling out vaccines, as we're trying to increase testing for people experiencing homelessness. And I'd be remiss if I didn't just express my gratitude to all the healthcare for the homeless providers out there who have been doing incredible work to partner with homeless programs and provide services to people experiencing homelessness during this time. What I do want to just highlight, though, what Barbara alluded to, was that we are also at this sort of moment of intensity, also at a moment of incredible opportunity with regard to our ability to not only just respond to the immediate crisis of homelessness and the immediate COVID-related challenges faced by people experiencing homelessness, but where we have incredible resources now through the American Rescue Plan to be able to address homelessness not only through shelter and services, but also through permanent housing, where the American Rescue Plan provides two significant funding opportunities. First and foremost, $5 billion in emergency housing vouchers that translates to about 60 to 70,000 Section 8 level housing vouchers that can be used to immediately connect people who are experiencing homelessness into apartments that can be leased on the private market. That's probably the single largest investment at any one point in time of new vouchers, of permanent vouchers for people experiencing homelessness. And then in addition, another $5 billion that HUD is providing to help communities to build more supportive and affordable housing, including through the purchase and conversion of hotels that have been used over the past several months to provide non-congregate shelter. That $5 billion is through our Home Investment Partnerships program, but essentially provides grants to communities that gives them capital as well as some funds for short-term rental assistance and also services. So now we have $5 billion in home that we estimate could create up to 32,000 new units of permanent supportive and affordable housing. And I mentioned $5 billion in vouchers that will go to people experiencing homelessness. That translates to about 60 to 70,000 vouchers. What we don't have is a dedicated funding stream for supportive services. And so many of you who, in addition to providing primary care, mobile health services, and now COVID-related health services for people experiencing homelessness, some of you have also done other kinds of services that help with housing navigation, helping make referrals to housing programs, as well as providing ongoing supportive services within supportive housing settings. And I think this is a real moment for all of you to consider how these funds that you're receiving, the $6 billion in American Rescue Plan funds, may be an opportunity to really help communities to provide the kind of both housing navigation and wraparound services that people will need to be able to fully make use of these vouchers, as well as the home grant dollars that in the supportive housing that will be built. So really, this is just a chance for me to share with you that I think we, again, have an opportunity. If we can figure out ways to connect the dots, and again, meet some of the immediate needs, but take advantage of these resources to make the biggest difference we can make in the lives of people experiencing homelessness, which is not only to help them access healthcare while they continue to stay homeless, but frankly, to ultimately bring them into permanent homes where we know their chances of having better health outcomes will just be that much greater. So I'm happy to answer more questions, but I'll turn this back to you, Barbara.
Great, thank you, Richard. And actually, I will put one question that did come in while you were talking. Rhonda Hoff out in Yakima, Washington says that she hasn't talked to her housing authority about this yet, but are all housing authorities receiving funding, or will they be going through a competitive process?
Will not be going through a competitive process. We are going to make those allocations within the first couple of weeks of May is when we are actually required by the American Rescue Plan to provide those allocations to the housing authorities. So I can't share at this moment how many vouchers each housing authority will receive, but most housing authorities will be eligible to receive a certain amount of vouchers. So they'll get a notification in early May about the number of vouchers that they're able to receive. it's not competitive, so they basically can opt in and say we'd like our full allocation, or we'd like some portion of the allocation of vouchers that our housing authority is slated to receive. And then that will also come with some more information about some of the requirements that HUD will be providing. Without getting ahead of our Office of Public and Community Housing, who administers those vouchers, I'll just say finding partnerships with the homeless service system is going to be really key. And so I encourage all of you to say, to approach your housing authorities now and say, you know, these emergency vouchers are coming that are intended to assist people who are experiencing and at risk of homelessness, and that there's an opportunity to think about how you all can assist with providing services coupled with those vouchers.
Great, thank you. And just in the interest of, I know we'll be getting to our discussion and we're starting to see some good questions roll into the chat. So why don't we just turn to my colleague, Julia Dobbins, who is our Director of Medical Research. And Julia just wants to do just a quick pitch about the vision for how this funding can be used for medical respite. And then after that, let's open up and start exchanging some ideas and revisiting some of this. Julia?
Yeah, sure. Thank you, Barbara. And I can do this quickly and just fully acknowledge that I am not objective here, that I have a lot of bias towards programs using some of this funding towards medical respite. But we were really thrilled to see that recuperative care medical respite was explicitly included in the American Rescue Plan. And we think that this is really a prime opportunity for you to explore the development of a respite program or the expansion of your respite services. So if you are in a community that already has an established respite program, this is the time to think creatively. So if you have a respite program that's maybe a 10-bed program at a men's shelter, this might be a good time to think about how you can create beds for women or folks who identify as women or as non-binary. Are you able to provide services for people in your respite program who need 6 weeks of IV meds? If not, maybe this is the time to develop that capacity. Do you offer occupational therapy services in your respite program? Wouldn't it be great if you could use this funding to pilot that, that program? So, and I want to speak just briefly, specifically about the exploration of respite or the development of respite programs. We are seeing more and more of our TA requests around the development or exploration of respite coming from homeless service nonprofits. And that's great. They're doing a great job. But we believe that it's best practice for respite programs to either be led by health centers or to be in partnership with health centers, especially HCHs, because we know HCH services are anchored in trauma-informed care and harm reduction, which our folks in respite desperately need and deserve. So if your health center is not engaged in some form in medical respite care, we need you to be. We need you in the medical respite game here. Your expertise and philosophy of care really add to this work. And I know the concept or the idea of potentially starting a respite program can seem very daunting, but I want to say some of the best run respite programs across the country are done in partnership with several other agencies. So it's not on your health center to do all the work. So use this opportunity to think about maybe how you can repurpose the alternate care sites you've been using for isolation and quarantine to become permanent respite beds, or potentially to fund a community task force to explore medical respite care. There's really so many opportunities to think creatively about how to start or expand respite services with this funding. And again, if you're interested in doing that, you won't be doing this work alone. Our little medical respite team of 1 has tripled in size in the last 6 months, and we're here to problem solve with you, to strategize with you, and to support you, and to ensure that until we get all of our folks housed, that they have a safe place to be while they are sick or hurt. So highly encourage you to consider respite, especially if you don't have respite services currently. We'd love to talk to you about it.
Great, thank you, Julia. So that concludes our initial pitch. And Brandon, if we could have the next slide with the discussion questions. Really what we wanted to do was open it up and get a sense from you on what questions you have or ideas or suggestions. And so within the extent that we've got about 130 folks in the room, we'll try to go to questions in the chat, as well as if anybody wants to raise their hand and talk for a minute or ask their question verbally, that's great too. Just want to point out on your screen under reactions, If you click that, there is a raise hand function. And so if you click on raise hand, we'll be able to call on you, and we'll just alternate between those in the stack in the chat and then those who might be putting up their hand. So I actually wanted to return to a question that we got earlier in the chat about domestic violence. And specifically, has there been any thought about bringing domestic violence advocacy into health centers as part of this bridge for survivors, or using the funding for this purpose there? And I think that's a great idea. And I think it's an issue, obviously, that's getting more attention too during COVID. Anyone just in the chat box, if we want to respond to that, or if folks want to raise their hand, that's great too. And just trying to put out the ideas as they come. Elena, you, I think we're going to be watching the stack, and I see that someone's got their hand raised.
Yep, David Motorsbach.
Ah, very good. David Motorsbach, let us, what do you got on your mind?
On my mind is that something a little sobering, or just to keep the giddiness down, is that when you look at this is a 2-year expansion, and it's time limited, and we just looked at our last year, our COVID-19 funding, the CARES funding, and the ECT funding, and we saw that actually, that funding last year, which really helped support our COVID response pretty much only, it's not much more than extending that funding of last year over the next 2 years. It's a little bit more, and that's exciting, but it's not that much more. So I really recommend that we all really clearly look at what is our COVID response been, and what have been our strengths and our deficiencies in our COVID response for these last 2 years, and really answer that question. And how do we use our last year's COVID funding to do that? And lay that down as the groundwork for looking at the next 2 years before we start thinking about new mobile clinics, extra money for this and that. It's just it's important to start with that foundation, because we're going to be dealing with COVID for these next 2 years. That's my first kind of impression of what are a first step to take. I really like, and I'm really excited about the ideas of developing partnerships. So, and we're really closely using this resource to look into that, and really thinking out of the box, especially just sharing this opportunity with new partners as well. We're trying to figure out how to do that best without promising people money, starting those conversations with new partners, and that's my first impression.
Thank you. Appreciate that. Want to pull a question out of the chat box again, while folks might be just considering what they might want to offer into the discussion. This is a question likely for Julia. Do you have communities that are doing respite care that are considered best practice that you could list out? And I think that you've done a number of products highlighting case studies recently. Maybe there's a number of resources you could recommend.
Sure, yeah, I was just answering that in the chat. There's so many that are doing fantastic work, and I want to call out that there are respite programs that have been established for 30 years that are doing fantastic work, and respite programs that have been up and running that have 2 beds that are doing fantastic work that have been running for a year. So how we define best practice in respite doesn't mean that it is a $4 million program with 150 beds necessarily. So yeah, I will put some resources in the chat. There are some really great small programs that are functioning well, and there are some really great large programs. And I'm happy to connect you directly to some of these programs. But yeah, to list them, there are over 115, and I think many programs are doing great work. But yeah, Wendy, I'll reach out to you individually and we can chat.
Great, thank you. I'm also seeing some questions being put to Richard in the chat box, and he's a great resource. So, but Richard can only be with us for the next 9 minutes. So if you have questions for Richard, now's the time to hit him up in the chat box. And Richard, if you're also, feel free to jump in too, because if you want to raise some, if you're seeing some questions where you want to offer some more detail, please feel free. So just let us know.
Yeah, thanks, Barbara. I think I saw a question about whether these vouchers are going to have or require a homeless preference. Not exactly, but I think and again, I'm getting a little ahead of our actual guidance and announcement on this, but I'll just share These are not your typical housing choice vouchers that go to a housing authority's regular waiting list and then go through their wait list preferences. These, because these are emergency vouchers, they're funded through the American Rescue Plan. They are a little different. And so communities have basically 3 eligible populations: people who are currently homeless, people who are at risk of homelessness, people who are fleeing domestic violence. Those are the 3 populations. We are going to require housing authorities to have a partnership with Continuums of Care or homeless service agencies. They're going to have to receive referrals from the homeless service system, and unless they can demonstrate that would not be viable. The regular homeless preference won't even be necessary, because really what housing authorities are going to be required to do is to ensure that they're receiving referrals for these vouchers from the COC or homeless system.
Thank you, appreciate that. I'm just looking here, a question from Jonathan Brown. We've maintained limited on-site visit capacity even when most staff were forced to work remotely. And during this time, turned our exam rooms into telehealth phone booths to facilitate our most vulnerable patients' continued access to care team. Has anyone developed or planned to develop a solution to extend telehealth services to individuals without access to the needed technology? Great question, Jonathan. Curious if anybody has perspectives on telehealth or any of those, maybe raise your hand. So let's put this out into the group for discussion. And Elena, I see that someone does have a raised hand.
Yes, Alexandria Gonzalez.
Oh, hi, Alexandria. Sure. What's your comment?
Okay, couple of things. So, as a formerly homeless individual, I feel like what we tend to lack is that, you know, whether you're making whether you're selling a product or whether it be a service provider, you know, we're trying to fix a problem or fix a pain reliever for that person, right? So, is there any money for like new innovative systems that are actually putting the homeless people at the forefront? Because in Rhode Island, I mean, it's just, it's very capitalized out here. You know, the same org runs the COC, they hold the HMIS, they, you know, it's just, and they run the CES, and we only have one access to CES in Rhode Island, which is a telephone line. And, you know, I've had so much like, I guess, burn back or competition. And it's like, it's hard for me to get my org off the ground because of it's so competitive out here. Like I need to have so much funds to apply for this funds or this, that, and the third. Like there has to be other ways that homeless service providers that are formerly homeless, that actually know what the community needs, can access funds besides just the COC.
Thank you for that perspective. It's true. I mean, we do not have all funding for all things. I think we're trying to think about how we use this funding opportunity for the broad range of things in health centers. But your comment is well taken. I'm going to come back to hand raised Elena, who's on stack.
Yep, Rhonda Hoff.
Ah, very good, Rhonda.
Hi. So one of the things that we really saw very quickly around the topic of telehealth was really the big divide about those that did, and those who have, and those who have not. And so one of the things that we are just starting to pilot is to bring on a team of either peer counselors or community health workers. Part of this funding, just a bigger picture, is we've never really had a training department here in our organization. And so we're looking at bringing on a training department, but the first group are really going to be community health workers. And their task is going to be to work with our populations. We're sort of targeting our folks in supportive housing. And the community health workers will work with them either to find those that don't have cell phones already. The state of Washington, if you're on Medicaid, can provide an Android phone. And the community health workers will help individuals learn to use their cell phones, and then specifically help them learn to use telehealth to access our platforms, our video visits, and or patient portals, so that they can access information, ask for prescriptions, talk to their doctor, either through the patient portal or video visits, with the idea that the community health worker, these folks will be bilingual because we do have a large Spanish-speaking population here. And maybe with a goal of making the first 3 visits alongside with them. And so that's one of the things we have small grants that are funding the first 2 community health workers, but maybe ongoing through this grant to bring on a team and really support the whole infrastructure of a training department. So we're kind of looking at a bigger picture around that, just because we have lots of people that could use that support. So that's an idea that we're trying to develop right now.
That sounds great. And I'm seeing a lot of love being given in the chat box for the community health workers. So I think a lot of folks are thinking in that regard. And I know that this is an area of HRSA in particular, that there are plans to expand specifically a community health worker program within HRSA's workforce area. So I think this is a burgeoning area that obviously has got a lot of application. I do see another hand raised. Elena, who's on deck?
Yeah, Sherry Campbell.
Oh, Sherry. What have you got to share for us?
Hey, thank you. I'm with a small organization. We're a hospice home, but we've also started with cancer respite care. So we're a nonprofit organization. I clicked on the link and saw for my state that the funding went to the local housing hospital authority and to the county. So is that who I would reach out with to see if they would consider funding us? I just don't know how the money's trickling down to the people that are, on the street, the frontline workers.
Sure. No,
Thank
absolutely.
you.
Sherry, what kind of program are you in right now? Are you calling from a health center or another type of community program?
We're a hospice home.
Okay.
Welcome Home of Chattanooga in Tennessee.
Okay. So if you clicked on this on the link and you saw that the money was funding to the county and the hospital authority for this funding, then they would be good ones to reach out to indicate like what, how you can be collaborative with them on this funding, and maybe ask them what goals they had established for this and how those goals might align with what you are doing, and then think about how you might pull together a partnership that would be really advantageous for everyone. But I think right now the real key is kind of reaching out and getting those conversations going so that you can kind of establish what the possibilities are right now. And even if it isn't right now with this funding, it could be that you could be part of this longer strategy for where that might go. So I definitely wouldn't discount any possibilities.
Is there a place that we could see? I mean, I guess I could Google it, what my county or the hospital authority had decided to do with the funding they received.
They might not know just yet. So I think this is why this conversation we're hosting, so that you can, before those decisions get made in a way that's reversible, for example, getting in early to be able to say, hey, what can we really be doing here? So I wouldn't worry about whether final decisions have been made. I would definitely just think about the partnership and the conversation that you're starting.
Thank you.
Yeah. And then I also want to come in here as well. Let's see, we're looking at some telehealth questions. Jonathan Brown had put in some questions about his telehealth. We've maintained limited on-site visit capacity. Has anyone developed a solution to extend telehealth services to individuals without access to the needed technology? So I believe we've talked about this. But telehealth and technology are such a critical need. And I know that there have been a number of legislative fixes in state legislative houses to try to add the audio only and to be able to give us the more flexibility more permanently. Didn't know if we want to come back to the telehealth piece, and if anybody had any comments about that, either verbally or in the chat, just want to invite that. And Elena, I see that we've got another hand raised.
Yeah, Andrew Grimm.
Oh, hi, Andy. Yeah.
Hey, good morning, Barbara. Good morning, everyone. Yeah, I actually wanted to jump in on the kind of technology telehealth piece and say here at the Colorado Coalition for the Homeless, we're really focusing on how this can help us improve our data and reporting infrastructure. Along with all of these awards, there's just so much more demand on data reporting and understanding productivity and understanding where all of this grant money is going. And we've felt like for a while, we've really had many multiple different systems that we really struggle to bring information together from all of the various data sources that we have. So we're really focused on how we can use a consultant, use NextGen, which is our EHR, to help us make some practice management workflow improvements. So I think moving to telemedicine also demands that we really look at how we're reporting on the new work that we're doing. So just wanted to throw that out there as a thought.
Love it. Thank you, Andrew. Also, just want to give a shout out to Thomas Lovell, who had put in the chat that he was thinking about using the some of these funds for their DEI, their diversity, equity, and inclusion activities. Obviously, an express allowable activity. I think that's really great. And a couple of you have messaged me to say that you don't have a raise hand function. So obviously that will be interfering in your ability to make comments. So I'm just going to give a shout to Tom Andrews, who said that he is trying to raise his hand but can't find it. Tom.
It's probably more of a user error than anything else, Barbara. Good afternoon, everybody. I just wanted to do a shout out for the community health worker focus. We've been doing a pilot called the Community Resource Hub, which is focused on the data we collect for our patients that have social determinants of health. And we've been running that pilot for about a year, year and a half, and it's allowed us to create really warm handoffs with other agencies in Atlanta that we work with around housing and access to food and legal and jobs. We're opening up a resource center that's going to kind of activate this program more broadly, and we're going to be hiring some community health workers to staff that resource center so that as people come in and need access to other agencies, we'll be able to give them access to computers and telephones and really facilitate them, filling out applications. So we're going to be using community health workers really extensively for that.
That's fantastic. Thank you. Great ideas. Also looking at LaWanda Williams put into the chat box, workforce wellness activities, obviously worthwhile considering the stresses that COVID has created for staff. I mean, there's a lot of staff wellness opportunities here and just trying to backfill. It has been a traumatic and very, very stressful year for a lot of our folks. And I see Rebecca Levinson, you're next on deck, is that right?
Yeah. Thanks. I just wanted to mention I'm very excited to hear about the community health worker expansion and sort of the innovation around it. And one of the things that we have been looking at, so at Futures Without Violence, is ways in which we can create a mechanism such that folks who we are serving are poised to be experts and support others in their communities. So we have an intervention we're calling Cues, and a tool that's been developed as a way to sort of bridge the reality that many of the folks that we serve come from very complicated stories. And so a universal education approach prior to asking direct questions that are very pointed and invasive has proven to be just a really interesting strategy. And so that's just something for you all to know, that there's some thinking around, well, what does it look like when you do intake for someone who is homeless, and how many forms need to be filled out, and how do we create a space where folks are feeling seen and held and given space for what they do or they don't want to talk about, and as a framework. So I just wanted to mention that that is a strategy that we've been using that has been interesting.
Thank you, Rebecca. I want to also mention, just pulling out of the chat box here, Megan Westbrook brought up that the broadband benefit, that the FCC is hosting a consumer-focused webinar on the emergency broadband benefit on Tuesday, April 27th at 3 o'clock Eastern, and put the registration link here. So thank you, Megan, for that. For those who are interested in pursuing telehealth, the FCC is putting out a consumer benefit that will help individuals better access telehealth. So that might be something to look into. And we are also getting more information about that here at the council so that we can be putting that in an upcoming communication. And if anyone has any more information about that or telehealth, feel free to raise your hand. Want to also just mention here another question Irene had put in the text box or in the chat box. We're looking into minor renovations at a detox center that isn't currently in scope for our services. Do we know whether this is acceptable for the funding? I would say, Irene, that based on my reading of the limitations and the requirements for this funding is that it has to be in scope. So if you are interested in bringing the services at the detox center into your scope, then this would be allowable. And there is also, I think, was it 50,000? I'm trying to remember what the limit was on the renovations for capital improvements. And I will say, and I think I might have forgotten to mention earlier, that if you are thinking about capital improvements, that Jim McCrae at HRSA did say that there is a capital funding opportunity that will be coming down the pike very soon and shortly, as Jim likes to say. And so it may be that if you are thinking about building something or something more significant, that waiting for that funding opportunity might be better, but it might also fit with what you're doing here with this plan that might complement whatever capital work you're doing. So just wanted to put in that for both telehealth and the capital work, and see if we've got anybody with a raised hand. Elena, I don't think we've got anybody in the stack.
No, not that I can see.
Got it. Thank you, Irene, put into the chat box. It's a $500,000 cap for any renovations that you would want to do. So thanks, guys. Other issues that we want to raise that we haven't brought up yet. I know we're in our last few minutes. If anyone had any comments that they wanted to offer, either in the chat or to raise your hand if you have a raised hand function. And then in the meantime, I know we are coming down to our last few minutes. I believe we have an evaluation link. If maybe we wanted to put that in the chat box with just a few questions that would take you. We really wanted just to ask about how you were thinking of moving forward and what our next steps would be. And so part of it is that I know we are thinking about how to use this funding, and we do need to indicate to HRSA what those plans are going to be on or about the end of May, seems to be the 60-day cutoff. And so thinking through what are the next steps that we want to take as a community, either to do maybe a smaller group discussion. To be honest, in setting up this discussion, we didn't know whether small group breakouts around specific subjects would be better, or if we should just keep it broad and let people exchange ideas and questions. And as you see, we decided to keep it broad. But in moving forward, if we've got a lot of folks that really do want to have a strategic discussion about how to use these funds on medical respite, services and supportive housing, some of the telehealth or medical legal partnership that Darlene had described, we're really excited about supporting that. I'm just looking at this here. Yes, and to some household, yes, this recording and the slides will be available, so that will come in. And then any other comments that anybody wanted to make or any hands raised before I turn it back over to Bobby Watts, our CEO?
Not seeing any more raised hands. I just want to thank everyone for this conversation. And please fill out the survey. In there, we will be, there are questions about whether you would like to have smaller discussions around particular topics. So that's really good information that we would need to try to convene that. We are here to support you in this unprecedented opportunity to use the funds wisely that will impact your program, your agency, your community, and most importantly, the people experiencing homelessness that you serve, but also the systems, if we can make the systems better. So just as a final thought, some things that came up before, but not in this conversation, think about training for your staff. That's one-time funding you can invest that can have a long-term effect. Also, strategic planning and other forms of capacity building for your organization. And just really want to thank you. This is the genius of the council coming together, brainstorming, helping each other. And we will look at the questions that were put in the chat, try to follow up with as many as we can. The resources have been put in the links in the chat. They will be they're part of this recording. So we just thank you for joining us, for adding to the richness of our community with your participation, whether by raising your hand and speaking or putting information in the chat. And please look out. We will be looking to support you with more convenings, a smaller convening around various topics that you identify as where there's a tremendous interest. So I want to thank all of those who presented, especially Richard Cho, who probably had to sign off, but really appreciate all of you. And we are in this together. We are in this, and we are stronger together as a council when we are working, solving these problems and taking advantage of these opportunities together. So thank you very much, and stay tuned. Appreciate you all. Goodbye.